Okay, dear students, today we will learn about the gross anatomy of humerus. It is the longest bone in the upper extremity and it remains in the arm. Okay, the humerus has upper end, shaft and lower end. At first we have to learn about the anatomical position of the humerus. This is a right-sided humerus and the anatomical points will be that the upper end is rounded and the lower end is expanded from side to side and flattened anterior posteriorly, and the head, this is the head directed upwards medially and slightly backwards. The anterior aspect of the upper end bears the lesser tubercle. You will tell in anatomical position that the lesser tubercle projects forward from the anterior aspect of the upper end. Okay, this is all about the anatomical position. Now the parts of humerus. It consists the upper end, intervening shaft and the lower end. Okay, in upper end there is a head. It forms one third of a sphere and directed upwards medially and slightly backwards, and it bears the necks. There are three necks actually in the humerus. One is anatomical neck, that is just the joining point of the head and the rest part of the upper end. This is the anatomical, see that this is the anatomical neck, and there is a surgical neck. It is the joining point between the upper end and the shaft. This is the surgical neck. Then the morphological neck, it is about 0.5 centimeter below the surgical neck and very close to the surgical neck actually. And the morphological neck represents the epiphyseal line of the upper end. Okay, the upper end also consists the lesser tubercle and the greater tubercle. Okay, there is three impressions in the greater tubercle. One is superior impression, then another one is medial, and the last is the lower impression in the greater tubercle. Okay, in between this tubercle there is a groove. This is the intertubercular groove, or another name is bicipital groove. Okay, this groove consists on medial lip, on lateral lip, and the floor. Okay, this is all about the upper end and the shaft. This is the shaft, and the shaft bears anterior border, lateral border, and the medial border. Okay. Now the anterior border, it is rounded in the lower part and it extends up to the lateral lip. It extends up to the lateral lip of the bicipital groove. Okay, this is the extension of the anterior border. And now the medial border, it extends from the medial supracondylar ridge and up to the medial lip of the bicipital groove. This is the tracing. You see that this is the tracing of the medial border. Okay, there is a rough impression in the medial border near about the middle part, and the lateral border. This is the lateral border. It extends from the lateral supracondylar ridge up to the posterior aspect of the greater tubercle. Okay, this is the tracing of the lateral border. This lateral border is intervened by or traversed by the spiral groove. Okay, now the surfaces of the humerus. One is anteromedial surface, another one is anterolateral surface, and rest is the posterior surface. Okay, now the anteromedial surface, it lies between the anterior border and the medial border. Okay, you see that this is the anterior border. It lies between the medial border and the anterior border, and the medial border extends up to the medial leaf of the bicipital groove, and the anterior border extends up to the lateral leaf of the bicipital groove. That's why the floor of the bicipital groove forms the upper part of the anteromedial surface. Then the anterolateral surface, this is the anterolateral surface, and it lies between the anterior border and the lateral border. Okay, this is the anterolateral surface, and there is a rough V-shaped, this is the rough V-shaped tuberosity. This is deltoid tuberosity. It is an important feature, you have to remind it. And then the posterior surface in between the this is the medial border and the lateral border. Posterior surface in between these two borders, and there is a oblique line. You see that there is an oblique line here. Okay, there is an oblique line here, and the spiral groove or bicipital groove also present here in the upper part. This spiral groove in the upper part. Okay, that are the features of shaft of the humerus. Then the lower end, it is the lower end, and it is expanded from side to side and flattened anteroposteriorly. Okay, the lower end has articular part. This is the articular part. Okay, the articular part consists capitulum that lies laterally, and the trochlea. This is the trochlea. This part is trochlea, and the capitulum articulates with the head of the radius, and the trochlea articulates with the head of the ulna. Okay, this is the articular part. And the non-articular part. Non-articular part consists some fossa. That is, one is coronoid fossa. It lies just above the trochlea and in anterior aspects of the lower end. It is the coronoid fossa, and the radial fossa. Radial fossa just above the capitulum in the anterior aspect, and there is a olecranon fossa. Okay, olecranon fossa just above the articular part in the posterior aspect. It is a deep fossa. Okay, and the non-articular part also consists to epicondyle. One is medial epicondyle, this is more prominent, and the lateral epicondyle. Okay, these are the features, parts of the humerus. Now the attachment. Okay, attachment in the upper part, at first in the neck, anatomical neck. This is the anatomical neck. The capsular ligament is attached. There are some fissure in this attachment, capsular ligament. It is not in whole length of this anatomical neck. In case of medial part, the capsular ligament extends slight downwards and then again to the anatomical neck. Okay, and close to this bicipital groove, there is no capsular ligament. There is a gap due to the passes of the long head, tendon of the long head of the biceps femoris, biceps brachii. Okay, tendon of the long head of the biceps brachii. It is intracapsular. That's why the capsule remains a gap here, close to the bicipital groove. Okay. Now the attachment of the lesser tubercle. The lesser tubercle gives attachment to the subscapularis muscle, and there is 3 impressions. You have already known that there is 3 impressions in the greater tubercle. One is the upper impression, where the supraspinatus muscle gives it insertion, and the middle one gives the infraspinatus, attachment to the infraspinatus, and the lower impression gives attachment to the teres minor. Okay, now the leaves of the bicipital groove, the lateral leaf gives attachment to the pectoralis major muscle, and it is a bilaminar insertion. Okay, the medial leaf of the bicipital groove gives attachment to the teres major, and in between these two, the floor of the bicipital groove gives attachment to the latissimus dorsi muscle. Okay, now an important information about this groove in bicipital groove. What are the contents or relations of this bicipital groove? Okay, the relation of this bicipital groove is that, or content of the bicipital groove is that the long head of the biceps femoris with its the long head of the biceps brachii with its synovial sheath and a ascending branch of anterior circumflex humeral artery. The circumflex humeral artery actually lies like this circumferentially, and it gives a ascending branch in the bicipital group. These contents are very important, you have to remind it. And the attachment of the shaft. Okay, attachment of the shaft, there is a large attachment in the lower part of the anteromedial and anterolateral surface. This is the biceps, this is the brachialis muscle. Okay, this is the brachialis muscle, and the rough impression in the medial border gives insertion to the coracobrachialis muscle. Okay, this is a muscle that arises from the coracoid process of the scapula, and the rough area in the anterolateral surface V-shaped rough tuberosity, that is the deltoid tuberosity. It gives insertion to the deltoid muscle. Okay, now the posterior surface gives attachment to the two heads of triceps brachii, and the triceps has three heads, on his long head, on medial and on his lateral. Okay, there is the oblique line in the posterior surface and bicipital groove also. From this oblique line, the lateral head of the biceps brachii arises, and the posterior surface below the spiral groove or radial groove, this surface gives attachment to the medial head of the triceps brachii. Okay, and the long head of the triceps brachii arises from the infraglenoid tubercle. Okay, then the triceps gets insertion to the upper surface of the olecranon process of ulna. Okay, now this is the attachment of the posterior surface, and the lower end, attachment of the lower end, there are two supracondylar ribs. One is lateral supracondylar ribs and the medial supracondylar ribs. Okay, from the medial supracondylar ribs, from the lower one third, the teres minor arises. This is the origin of the teres minor. The teres minor actually arises from the humerus and from ulna. Okay, the humeral part is lower one third of the lateral supracondylar ribs. Okay, and the medial supracondylar, it is medial supracondylar ribs, and from the lateral supracondylar ribs, from upper two third, it is the brachioradialis, that is from the brachium up to the radius. This is the brachioradialis from upper two third of the lateral supracondylar ribs, and from the lower one third of the lateral supracondylar ribs, the extensor carpi radialis longus. Okay, extensor carpi radialis longus, it gets its origin from the lower one third of the lateral supracondylar ribs. Okay, now the epicondyle, attachment of the epicondyle, medial and lateral. In case of medial epicondyle, the common superficial flexor muscle gets its origin from the medial epicondyle, and from the lateral epicondyle, the anconeus, and from the medial epicondyle, the supinator and the extensor, superficial extensor muscles from its common origin from the anterior aspects of the lateral epicondyle, and from the posterior aspects of the lateral epicondyle, there is another muscle, that is the anconeus. Okay, the anconeus and the extensor, superficial extensor groove from the anterior aspect of the lateral epicondyle. Now another important information is the attachment of the capsular ligament of the elbow joint. The lower end of the humerus and the upper end of the radius and ulna forms the joint. It is elbow joint, and the type is hinge variety of synovial joint. And upper end of the humerus form joint with the glenoid cavity, and it is the shoulder joint, and it is a ball and socket type of synovial joint. Okay, now the attachment of the capsular ligament of elbow joint, it is just through the margin of the articular part, and it also covers the fossa, okay, radial fossa, just like this, from the margin of the articular capitulum, then radial fossa, then coronal fossa, then the margin of the trochlea, and then it covers the polycronal fossa behind, and just like this. But this capsular ligament excludes the medial and lateral epicondyle. Okay. Now the nutrient foramen, just you see that in the middle of the anteromedial surface there is a foramen. This is the nutrient foramen, and the direction of the nutrient foramen is towards the elbow. Okay, as the nutrient artery goes to the elbow. Okay, another important information about this nutrient artery, the nutrient artery goes opposite to the growing end of a bone. Okay, that's why the nutrient artery goes to the elbow, and that's why the upper end of the humerus is the growing end. This is the information about the nutrient artery. And in clinical anatomy, the fractures are common in the surgical neck, in the shaft, and in the supracondylar region. Okay, in case of supracondylar fracture, the fracture actually occurs due to the fall on outstretched hand. Okay, when someone falls suddenly on his hand, when it is extended and outstretched, then the supracondylar fracture may occur, and the lower segment in most of the cases displaced dorsally, and the upper segment ventrally. And as there is brachial artery in front, and the upper segment displaced anteriorly, the upper segment causes compression on the brachial artery, and it may cause ischemia through the distal forearm, and that's why a pathology arises that is called Bachmann's ischemic contracture. Okay, now the Bachmann, after this there is a important information about the relation of the nerve to this bone. One is axillary nerve, it lies just like this around the surgical neck, and another one is radial nerve, it lies in the radial groove. Okay, radial nerve, and the ulnar nerve, it lies just behind the medial epicondyle. Okay, these are all about the gross anatomy of the humerus. Okay, thank you.